Hi, I'm Carly. I'm a student practical nurse of practical nursing. And now we're going to do a wound care assessment and wound dressing. So prior going into the client's room, you have to do hand hygiene, and of course, you have to say provide privacy and ask 3 identifications. What's your name, your date of birth, and check their wristband. And of course, 30 to 60 minutes prior doing wound care, you have to give analgesics. And now we're going to put our gloves on. And let's take off the dressing of the wound. You have to take a look at the wound. Check the color, if it's bright red or if there's some eschar, which is a dead tissue. And check the wound if it's warm to touch. And check the exudate amount. If there's a serous, which is clear and yellow, and or serous sanguinis, which is serous fluid and blood, and purulent, which is thick and white and yellow. And you have to state if it's scant or large or moderate amount of serous sanguinous or serous fluid. And check if there's any granulation, red or new growth or eschar. And I said temperature and color. Now we're done assessing the wound, and you take off your gloves, throw it in the garbage, and do hand hygiene. And now we're checking our solution for the cleaning. Check the expiration date and clean the wound and check the temperature. It has to be room temperature. We're done. And now I open my dressing tray, so I'm just going to use it again. But you have to check the expiration date of your dressing tray. And of course, you have to use a 4x4 gauze and RC and swab that you have to send to the lab. Now you do hand hygiene again, and we're getting our dressing tray. You can use gloves or it's up to you, but we're just opening. So open. Now we have our forceps there, and it's hard. Sorry. The inner part. You can use your hands, doesn't matter. This is considered the sterile one. There. And now put it on the side. Now you don your gloves again, the sterile one. Now I'm running out of gloves, sorry guys. So you have to state also that below the waist level is considered not sterile. If you put your sterile stuff below the waist level, it's considered not sterile, so you have to get another set of wound care solution. So now we're getting our forceps and our cleaning solution. So I'm just gonna use water for now because I don't have one. Pour it here. And get our forceps. Yeah. Just do like that. And squeeze it on the side for the excess solution. And you clean it from inner to outer or proximal to distal. You clean it, dropping it waist level, and you clean it again from inner to outer and drop waist level. Now we're done in cleaning the wound. I'll put this away. And now we're collecting specimen from the wound bed. Inner to outer. And then put your initials, the patient name, and the date of birth, and send it to the lab. And now we're covering the wound with 4x4 gauze, but I don't have one, so I'll just use the small one. Oh, yeah. Take off your gloves, sorry. Okay, cover, tape. I have my initials here, the date and time. Cover. And after that, you do hand hygiene. And then you're done. You'll be passed. This is how the college wants us to do, like step by step. Like, yeah. Thank you. Bye.